Vital signs taking. Vital signs taking is a procedure that provides data that reflect the status of several body systems that includes cardiovascular, neurologic, peripheral vascular, and respiratory systems. The sign of basic physiology is reflected in body temperature, pulse, respiration, and blood pressure. Measure temperature first, followed by pulse, respirations, blood pressure, and oxygen saturation. Purpose: to assess the client's condition, to determine the baseline values for future comparisons, and to detect changes and abnormalities in the condition of the heart. When to take vital signs. Number 1, upon admission as ordered. Number 2, any change in status with chest pain or any abnormal sensation. Number 3, before and after administration of preoperative medications. Number 4, after surgery or invasive diagnostic procedures. Number 5, before and after administration of blood products or medications that can cause cardiovascular and respiratory changes. And number 6, before and after any nursing intervention that can affect the cardiovascular or respiratory system. Materials and equipment: thermometer, tympanic thermometer, digital oral, auxiliary, and or rectal thermometer. Stethoscope, sphygmomanometer with appropriate cuff size, watch with second hand, pulse oximeter, swab or cotton ball soaked with alcohol, sponge towel, paper bag, record form sheet, ballpoint pen, blue, black, and red, one each color, and tray to set all equipment needed, and the toilet paper. Measuring temperature or temperature taking. The process of measuring or monitoring the patient's body temperature using a clinical thermometer. It may be taken through the axilla, orally, or through the tympanic membrane. Normal axillary temperature range is 35.4 to 37.0 degrees Celsius or 95.6 to 98.5 degrees Fahrenheit. The normal oral temperature is 35.9 to 37.5 degrees Celsius or 96.6 to 99.5 degrees Fahrenheit. The normal tympanic temperature range is 36.7 to 38.3 degrees Celsius or 98.0 to 100.9 degrees Fahrenheit. Temperature below 36.7 degrees Fahrenheit or 98.0 degrees Fahrenheit represents hypothermia and can be a result of prolonged exposure to cold, hypoglycemia, hypothyroidism, starvation, neurologic dysfunction, or shock. Temperature above 38.3 degrees Celsius or 100.9 degrees Fahrenheit represent hyperthermia and can indicate bacterial, viral, or fungal infections, an inflammatory process, malignancies, trauma, or various blood, endocrine, and immune disorders. Purpose: to determine body temperature, to assist in diagnosis, to evaluate patients' recovery from illness, to determine if immediate measures should be implemented to reduce dangerously elevated body temperature or conserve body heat when body temperature is dangerously low, and to evaluate patients' response once heat-conserving or heat-reducing measures have been implemented. Temperature below 36.7 degrees centigrade or 98 degrees Fahrenheit represents hypothermia, and temperature above 38.3 degrees centigrade or 100.9 degrees Fahrenheit represents hyperthermia. Taking axillary temperature. Assessment. Number 1, assess client skin if warm to touch. Rationale, to know if the client is experiencing any fever or to assess of the client if the client is in normal condition. Number 2, assess for most appropriate site to check the temperature. Nationale, so that the client will be comfortable. Planning. Number 3, wash hands. For the rationale, to reduce the risk of transmitting infection among the client. Number 4, gather the equipment needed for the rationale in order to save time when proceeding to the assessment. Implementation. Number 5, check the client's identification. Rationale, to confirm the necessity. Number 6, introduce self and explain procedure to the client. For the rationale, providing information fosters cooperation and understanding. Number 7, close doors and use a screen. For the rationale, it maintains client's privacy and minimize embarrassment. Number 8, take the thermometer and wipe it with cotton swab for bulb towards the handle. For the rationale, wipe from the area where few organisms are present to the area where more organisms are present to limit spread of infection. Number 9, press the button that will erase the digital numeric display. For the rationale, to reset the thermometer. Number 10, assist the client to a supine or sitting position. For the rationale, to provide easy access to axilla. 11, move clothing away from shoulder and arm. For the rationale, to expose axilla for correct thermometer bulb placement. Number 12, be sure the client axilla is dry. If it is moist, pat it dry gently before placing the thermometer. For the rationale, moisture will alter the reading. Under the condition, moistening temperature is generally measured lower than the real. Number 13, place the bulb of thermometer in hollow of axilla at anterior inferior with 45 degree or horizontally. For the rationale, to maintain proper position of bulb against blood vessels in axilla. Number 14, keep the arm flexed across the chest close to the side of the body. For the rationale, close contact of the bulb of the thermometer with the superficial blood vessels in the axilla ensures a more accurate temperature registration. Number 15, hold the thermometer in place until you hear a beep sound. For the rationale, to ensure an accurate reading. 16, remove the thermometer and read the numeric display to know the temperature of the client. 17, record the temperature reflected in the digital display and press the button to erase the numeric display. For the rationale, because it is important and for the thermometer to be used again. Number 18, disinfect the thermometer. Take the thermometer and wipe it with cotton swab soaked with alcohol from handle towards the bulb. For the rationale, to avoid getting contaminated. Number 19, explain the procedure and instruct the patient if he or she has fever or hypothermia. For the rationale, so that the client will have an idea. Number 20, dispose the soiled materials properly and wash your hands. For the rationale, proper disposal is important to avoid contamination. Number 21, return all equipments to its place. For the rationale, to avoid misplacing. Evaluation, evaluate the temperature taken. For the rationale, to nursing efficacy in achieving client objectives. Documentation, record the temperature taken and affix signature on the chart. For the rationale, in order to spot unusual readings. Number 24, report any abnormal reading to the senior staff. For the rationale, in order to respond immediately. Taking oral temperature. Assessment. Assess the client if the skin is warm to touch for the rationale. To know if the client is experiencing any fever to assess if the client is normal. Number 2. Assess client mouth for oral lesions and sores. For the rationale, to give a starting point for information concerning your patient's mouth condition. Planning. Number 3. Wash hands. For the rationale, to reduce the risk of transmitting infection among the client. Gather the equipment needed. For the rationale, in order to save time when proceeding to the assessment. Implementation. Check the client's identification. For the rationale, to know the client. Explain the purpose and the procedure to the client. For the rationale, so that the client will know how the procedure works. Close doors and or use a screen. For the rationale, less exposure to other client. Take the thermometer and wipe it with cotton swab from bulb towards the handle. For the rationale, to avoid contamination and to remove bacteria. Press the button that will erase the digital numeric display. For the rationale, to measure the temperature accurately. Assist the client to a supine or sitting position. For the rationale, to ensure that all of the patient's anatomical structures are in natural or neutral alignment. Ask the patient to open his or her mouth. For the rationale, to put thermometer to patient's mouth. 12. Place the thermometer under the client's tongue to the right or left of the frenulum, deep in the posterior sublingual pocket. For the rationale, to get the correct reading of inner body heat. Ask the client to close his or her lips around the probe. For the rationale, to hold the thermometer and to prevent biting it. Hold the thermometer in place until you hear a beep sound. For the rationale, to ensure that the temperature is done by beeping sounds. Remove the thermometer and read the numeric display. Record the temperature reflected in the digital display and press the button to erase the numeric display. For the rationale, recording is vital, especially in temperature taking. Disinfect the thermometer. Take the thermometer and wipe it. For the rationale, to avoid contamination. Explain the result and instruct the patient if he or she has fever or hypothermia. For the rationale, so that the client will have an idea about her health status. Explain and dispose the soiled materials properly and wash your hands. For the rationale, appropriate disposal is critical as is avoiding infection. Return all equipments to its proper place. For the rationale, in order to avoid misplacing and equipment. Evaluation. Evaluate the temperature taken. For the rationale, it helps to assure the care provider on the accuracy of the diagnosis. Documentation. Record the temperature and affix signature on the chart. Report an abnormal reading to the senior staff. For the rationale, in order to respond immediately. Taking tympanic temperature. Assessment. Assess the client's skin if warm to touch. For the rationale, to know if the client is experiencing any fever. Assess the most appropriate site to check the temperature, either right or left ear. For the rationale, to get accurate result. Planning, wash hands. For the rationale, to reduce the risk of transmitting infection among the client. Gather the equipment needed. For the rationale, in order to save time when proceeding to the assessment. Implementation. Check the client's identification. For the rationale, to know the client. Explain the purpose and the procedure to the client. For the rationale, so that the client will know how the procedure works. Close doors and or use a screen. For the rationale, to obtain privacy. Take the thermometer and wipe it with cotton swab from bulb towards the handle. For the rationale, to avoid contamination and to remove bacteria. Press the button that will erase the digital numeric display. For the rationale, to measure temperature accurately. Assist the client to a supine or sitting position. For the rationale, to ensure that all of the patient's anatomical structures are in normal neutral alignment. Ask the patient to expose his or her ear. For the rationale, to check the ear of the patient. Place the probe of the thermometer very gently at the opening of the ear canal for 2 to 3 seconds. For the rationale, to avoid damaging the ear canal, the probe tip is carefully pushed into the hole. Hold the thermometer in place until you hear a beep sound. For the rationale, to ensure that the temperature is done by beeping sounds. Remove the thermometer and read the numeric display. For the rationale, to know the accurate temperature of the client. Record the temperature reflected in the digital display and press the button to erase the numeric display. For the rationale, to avoid contamination. Disinfect the thermometer. Take the thermometer and wipe it with cotton swab soaked with the alcohol from handle towards the bulb. For the rationale, to avoid contamination. Explain the result and instruct the patient if he or she has fever or hypothermia. For the rationale, so that the client will have an idea about his or her health status. Dispose the soiled materials properly and wash your hands. For the rationale, appropriate disposal is critical as is avoiding infection. Return all equipments to its proper place. For the rationale, in order to avoid misplacing the equipments. Evaluation. Evaluate the temperature taken. For the rationale, it helps to assure the care provider on the accuracy of the diagnosis. Documentation. Record the temperature and affix signature in the chart. For the rationale, in order to spot unusual readings. Report an abnormal reading to the senior staff. For the rationale, in order to respond immediately.
For now, ma'am, we're going to take your tympanic temperature. So, assuming that this is a tympanic temperature, we were going to put this on the client's ear. So, ma'am, may I... So, place the probe of the thermometer very gently to the ear of the client. So once you hear a beep sound, we were going to get the temperature. After we get the thermometer, we were going to disinfect it and record the temperature.
For rectal temperature, for the procedure, assessment, assess the client's skin if warm to touch. For the rationale, to reflect the presence of illness and injury as well as provide insight into the localized interactions between the body and the environment. Number 2, assess for most appropriate site to check the temperature. For the rationale, to ensure the temperature is measured accurately. Number 3, assess for any presence of lesions or sores in the anal region. For the rationale, to know if there are some infected area that may be entangled before taking temperature. Planning. Number 4, wash hands to reduce the risk of transmitting infection among the client. Number 5, gather equipment needed. For the rationale, in order to save time when proceeding to the assessment.
The temperature is 36.0, which means you are in normal temperature.
Pulse rate. The pulse rate is a measurement of heart rate, or the number of times the heart beats per minute. As the One, two, three, go. Pulse rate. The pulse rate is a measurement of heart rate or the number of times the heart beats per minute. As the heart pushes blood through the arteries expand and contract with the flow of the blood. Purpose: to determine number of heartbeats occurring per minute, to gather information about heart rhythm and pattern of beats, to evaluate strength of pulse, to assess heart's ability to deliver blood to distant areas of the body, to assess response of heart to cardiac medications, activity, blood volume and gas exchange, and to assess vascular status of limbs. Materials or equipment, watch with second hand. Different sites in taking pulse rate. radial, readily accessible and routinely used. Temporal, used when radial pulse is not accessible. Carotid, used for infants in case of cardiac arrest and to determine the circulation of brain. Apical, routinely used in infants and children up to 3 years of age, used to determine the discrepancies with radial pulse and used in conjunction with some medication. Brachial, used to measure blood pressure, used for cardiac arrest for infants. Femoral, used in cases of cardiac arrest for infants and children, determine circulation in the leg. Popliteal, used to determine the circulation in the lower leg and leg blood pressure. Posterior tibial, used to determine the circulation in the foot. Pedal, used to determine circulation in the foot. Assessment, assess client's condition for the rationale to take holistic approach to patients and determining their needs. Check nature of pulse to locate for the rationale to locate and conduct assessments with ease. Planning, wash hands for the rationale to reduce the risk of transmitting infection among the client. Assemble the equipment with the rationale in order to save time when proceeding to the assessment. Implementation. Identify client and explain procedure for the rationale to ensure safety and to increase client's compliance. Have the patient rest his arm alongside of his body with the wrist extended and the palm of the hands downward. For the rationale, the relaxed posture of the forearm is slightly bending of the wrist allows the artery to be palpated without restrictions. Place the tips of your middle 3 fingers on the palm side of the patient's wrist. Rest thumb on the back and the patient wrist. For the rationale, for the most part, the fingertips are the most sensitive region of the hand palpable pulses. Apply enough pressure so that you can feel the pulse. Not too hard, not too light. For the rationale, to properly analyze the regularity and pace of the pulse, a moderate amount of pressure is required. Using a watch with the second hand, count the number of pulsations felt in the patient's pulse for 1 full minute. For the rationale, this keeps the pulse from being overestimated. If the pulse rate is abnormal, repeat the counting in order to accurately determine its rate, quality, and rhythm. For the rationale, to keep microorganisms from spreading. Evaluation, evaluate nature of pulse. For the rationale, to know the pulse if it is normal. Documentation, record result of rhythm and force in patient's chart. For the rationale, the result of the pulse that is taken is 65 beats per minute.
So, next ma'am is we're going to take your pulse rate. So, your pulse rate ma'am is 65 beats per minute.
Respiration, the number of breaths per minute, or more formally, the number of movements indicative of inspiration and expiration per unit time. In the practice, the respiratory rate is usually determined by counting the number of times the chest rises or falls per minute. The aim of measuring respiratory rate is to determine whether the respiratory are normal, abnormally fast, tachypnea, abnormally slow, bradypnea, or non-existent apnea. Normal range below 6 months 30 to 60 bpm or beats per minute, 6 to 12 months 24 to 30 beats per minute, 5 years 20 to 30 beats per minute, 6 to 12 years 12 to 20 beats per minute, and 12 years to adult is 20 to 12 to 20 beats per minute. Purpose: to provide valuable information about the client's physical and emotional health. Equipment: watch with second hand. Assessment: assess client's condition, check nature of respiration. For the rationale: to know if the client is ready to proceed and to know the proper way of getting respiratory rate. Planning: wash hands. For the rationale: to reduce the risk of transmitting infection among the client. Implementation: identify the client and explain the procedure. For the rationale: to ensure client safety while also encouraging participation. Hold the client's wrist just as if you were taking his or her pulse. For the rationale: so that the client will be at ease. Note the rise and fall of the client's chest. For the rationale: to show the client's normal breathing pattern. Using a watch with second hand. For the rationale: to obtain precise result. Wash hands. For the rationale: to keep the infection from spreading. Evaluation: evaluate the character of respiration. For the rationale: to check the client's breathing if it is normal. Documentation: record the character and the depth of the respiration. The results of the respiration of the client is 15 beats per minute.
So next, ma'am, we're going to get your respiration. Inhale, exhale.
Blood pressure taking. Pressure exerted on the wall of the arteries wherein the left ventricle of the heart pushes blood into the aorta. Purpose: to determine vascular resistance to blood flow. To determine the effectiveness of cardiac muscle in pumping blood to overcome the vascular resistance. Materials and equipment: blood pressure apparatus, sphygmomanometer, stethoscope, paper and pen, cotton ball soaked with alcohol. Assessment: assess the client's physical condition. For the rationale, an accurate assessment will aid in the selection of the most appropriate objectives. Assess the factors that affect blood pressure. For the rationale, maintaining cardiovascular homeostasis requires accurate blood pressure monitoring. Determine the client's baseline blood pressure. For the rationale, it makes a preliminary recording. Planning: wash hands. For the rationale, provides the client safety. Gather the equipment needed. Rationale: to save time when proceeding to assessment. Implementation: cleanse the stethoscope's ear pieces and diaphragm with a cotton ball soaked with alcohol. For the rationale: to avoid contamination. Check the client's identification. Explain purpose and procedure to the client. For the rationale: to gain client's cooperation. Have the client rest at least 5 minutes before measurement. For the rationale: to calm the patient. Determine the previous baseline blood pressure if available from the client's record. For the rationale to see the patient's past result. Identify factors likely to interfere with accuracy of blood pressure measurement, exercise, coffee, and smoking. For the rationale, these factors may accurate the blood pressure reading. Set the position. A. Assist the client to a comfortable position. Be sure room is warm, quiet, and relaxing. B. Support the selected arm. Turn the palm upward. And C. Remove any constructive clothing. For the rationale, a stable positioning creates the basis for the client to feel safe and relaxed. Checking of the brachial artery and dropping of the cuff. A. Palpate the brachial artery. B. Center the cuff's bladder approximately 2.5 cm or 1 inch above the site where you palpated the brachial pearls. C. Wrap the cuff snugly around the client's arm and secure the end approximately. For the rationale, the brachial artery is crucial for obtaining the systolic and diastolic blood pressure readings. Measure blood pressure by two-step method. A. Palpatory method. Palpate brachial pulse distal to the cuff with fingertips of non-dominant hand. Close the screw clamp on the bulb. Inflate the cuff while still checking the pulse with other hand. Observe the point where pulse is no longer palpable. Inflate the cuff to pressure 20 to 30 mercury above point at which pulse disappears. And open the screw clamp. Deflate the cuff fully and wait 30 seconds. For the rationale, with regular blood pressure measurements are done manually such as in wards, a BCOPD on treadmill, or when a stethoscope is accessible, the palpatory approach would be very beneficial. B. Auscultation. Position the stethoscope's earpiece comfortably in your ears. Turn tip slightly forward. Be sure sounds are clear and not muffled. Place the diaphragm over the client brachial artery. Do not allow chest piece to touch cuff or clothing. Close the screw clamp on the bulb and inflate the cuff to a pressure 30 mercury above the point where the pulse has disappeared. Open the clamp and allow the aneroid dial to fall a rate of 2 to 3 per second. Note the point on the dial when first clear sound is heard. The sound will slowly increase in intensity. Continue deflating the cuff and note the point where the sound disappears. Listen for 10 to 20 seconds after the last sound. Release any remaining air quickly and in the cuff and remove it. If you must recheck the reading up for any reason, allow a 1-minute interval before taking blood pressure again. For the rationale, its key benefits are similar to standard clinical blood pressure monitoring and precise detection of systolic and diastolic pressures on the present and disappearance of the sounds. Assist the client into the comfortable position. Advise the client of the reading. For the rationale, to make sure that the client is comfortable before starting the procedure. For the wash your hands. For the rationale, to ensure safety and to avoid spread of microorganisms. Record blood pressure on the client's chart. Sign on the chart and report any findings to senior staffs. For the rationale, it helps for determining whether a patient is developing chronic health condition. Return the instruments to proper place. For the rationale, to increase the accuracy and precision, which is arguably the most important aspect of any measuring equipment. Evaluation. Evaluate the nature of the blood pressure and evaluate the client's condition. For the rationale, to determine whether there is a chance for risk factors such as heart attack or stroke. To assess if the client is having any concerns or discomfort. Documentation. Record the result taken. The result is 100/60, which indicates normal.
And next is we will get your blood pressure.